manic is vanished. So today we want to talk about neurosis versus psychosis. Let's see. Do you ever wonder what is the difference between neurosis and psychosis? Well, the first one is neurosis. So what is neurosis? So neurosis is a mild mental disorder not arising from organic disease. Instead, it can occur from stress, depression, or anxiety. But without radical loss of touch with reality, means that the person is still able to do their work. But maybe it can be hard sometimes. So next is psychosis. So what is psychosis? So psychosis is a major personality disorder characterized by mental and emotional disruption, such as delusions, hallucination, emotional turbulence, abnormal motor behavior, and radical loss of touch with reality. So now we will compare neurosis and psychosis side by side. Let's see. For neurosis, the insight is present, but psychosis, the insight is absent. Neurosis, judgment and reasoning is intact, but for psychosis, judgment and reasoning is impaired. For neurosis, reality contact is present, but psychosis, reality contact is lost. For neurosis, delusions are absent, but in psychosis, delusions are usually present. In neurosis, true hallucinations are usually absent, but in psychosis, true hallucinations usually present. For neurosis, change in personality is usually absent, but in psychosis, change in personality may be there. Now you know. So now we will discuss about the types of neurosis. So for the first one is anxiety. So what is anxiety? Anxiety disorder include disorder that share features of excessive fear and anxiety and related behavioral disturbance. There are several types in anxiety, which are separation anxiety disorder, which means developmentally inappropriate and excessive fear or anxiety concerning separation from those to whom the individual is attached. Next is selective mutism. Selective mutism means when encountering other individuals in social interaction, children with selective mutism do not initiate speech or reciprocally respond when spoken to by others. Next is specific phobia. Specific phobia is marked fear or anxiety about specific object or situation. For example, flying, heights, afraid of animals, afraid of receiving an injection or seeing blood. Next is social anxiety disorder. Social anxiety disorder marks fear or anxiety about one or more social situations in which the individual is exposed to possible security by others. For example, include social interaction. Example, having a conversation, meeting unfamiliar people, or being observed like eating or drinking and performing in front of others like giving a speech. Next is panic disorder. Panic disorder is a recurrent unexpected panic attack. A panic attack is an abrupt surge of intense fear or intense discomfort that reaches a peak within minutes and during which time or more, like sweating, trembling or shaking, feeling of choking, chest pain or discomfort. Next is panic attack specifier. Panic attacks specifier symptoms are presented for the purpose of identifying a panic attack. However, panic attack is not a mental disorder and cannot be coded. Next is agoraphobia. Agoraphobia is marked fear or anxiety in following situations like using public transportation, being in open spaces, being in enclosed spaces, standing in line, or being in a crowd, and being outside of the home alone. Next is generalized anxiety disorder. Generalized anxiety disorder is an excessive anxiety and worry occurring more days than not for at least 6 months about a number of events or activities such as work or school performance. And lastly, substance medication-induced anxiety disorder, which is caused by a medical substance. So next is depressive disorder. There are several types in depressive disorder. For the first one is destructive mood dysregulation. It means a severe recurring temper outburst manifested verbally or physically that are grossly out of proportion in intensity or duration to the situation or provocation. Next is major depressive disorder, which means a depressed mood most of the day, nearly every day, such as feel sad, empty, or hopelessness. Next is persistent depressive disorder. It is a chronic major depressive disorder which at least the symptom lasts for 2 years. Next is premenstrual dysphoric disorder. This disorder happens during menstrual cycle. Next is substance medication-induced depressive disorder, which is caused by medication substances. Next is obsessive-compulsive. There are several types in obsessive-compulsive. For the first one is OCD or obsessive-compulsive disorder. It means the presence of obsession, compulsion, or both. Next is body dysmorphic disorder. Body dysmorphic disorder is the individual are preoccupied with one or more perceived fact of loss in their physical appearance, which they believe they look ugly, unattractive, abnormal, or deformed. Next is hoarding disorder. Hoarding disorder is a person who has persistent difficulties discarding or parting with possession regardless of their actual value. Next is trichotillomania or pulling hair disorder. It is a recurrent pulling out of one's own hair. Next is excoriation or skin pulling disorder. It means a recurrent picking at one's own skin. Next is substance medical obsessive-compulsive or related disorder, which is caused by medical substance. Next is trauma and stressor-related disorder. This disorder includes disorders in which exposure to a traumatic or stressful event is listed explicitly as a diagnostic declaration. There are several types in trauma and stressor-related disorder, which are reactive attachment disorder. It means a consistent pattern of inhibited, emotionally withdrawn behavior towards adult caregivers. Like, children are rarely or minimally seeks comfort when distressed, or a child rarely responds to comfort when distressed. Next is disinhibit social engagement disorder. It is a pattern of behavior in which a child actively approaches and interacts with unfamiliar adults. Next is post-traumatic stress disorder. PTSD is the development of characteristic symptoms following exposure to one or more traumatic events. Next is acute stress disorder. Acute stress disorder is an exposure to actual or threatened death, serious injury, or sexual violation, like directly experience the traumatic event, witnessing a person's the event as it occurs to others, or learning from the event itself. Next is adjustment disorder. It is the development of emotional or behavioral symptoms in response to an identifiable stressor occurring within 3 months of the onset of the stressor. So now, we will move to the types of psychosis. This one is schizophrenia spectrum. There are several types in schizophrenia spectrum, which are brief psychotic disorder. Brief psychotic disorder is a disturbance that involves the sudden onset of at least one of the following positive psychotic symptoms, like delusion, hallucination, disorganized speech, like frequent derailment or incoherence, or grossly abnormal psychomotor behavior, including catatonia. Next is schizophreniform disorder. Schizophreniform disorder is distinguished by its difference in duration. The total duration of the illness, including prodromal, active, and residual phases, is at least 1 month but less than 6 months. Next is schizoaffective disorder. Schizoaffective disorder is based on the assessment of an uninterrupted period of illness during which the individual continues to display active or residual symptoms of psychotic illness. Next is schizophrenia. The characteristic symptoms of schizophrenia involve a range of cognitive, behavioral, and emotional dysfunction, but no single symptom is pathognomonic of the disorder. Next is delusional disorder. It is the presence of one or more delusions with a duration of 1 month or longer. Next is bipolar disorder. There are several types in bipolar disorder. First one is type 1. For a diagnosis of bipolar 1 disorder, it is necessary to meet the following criteria of manic episode. The manic episode may have been preceded by and may be followed by hypomanic or major depressive episode. Next is type 2. For a diagnosis of bipolar 2 disorder, it is necessary to meet the following criteria of a recurrent or past hypomanic episode and the following criteria of a current or past major depressive episode. Next is cyclothymic disorder. The essential features of psychotic disorder is the chronic, fluctuating mood disturbance involving numerous periods of hypomanic symptoms and periods of depressive symptoms that are distinct from each other. So, we have discussed about the difference and types of neurosis and psychosis disorder. To be sure that this video is an educational purpose only. If you are concerned about your mental health problem, make sure to seek a health provider near you. Always remember that we are not alone in this world. Because eventually we all need support from each other. Bye!